Thanks for being so fun.
Okay, I'm Michelle Woolley, and I'm here to talk to you today about early stroke education. So we'll start with figuring out what a stroke is exactly. And it is an emergent medical condition where blood flow and therefore oxygen and nutrient flow to the brain is stopped or compromised in some way. There are two kinds of strokes. The first is ischemic, which is a blood clot that blocks some sort of vesicle, either a vein or an artery, to or from the brain. And the most common of that type of stroke, which also these are the most common kinds of strokes of the two, are TIAs, or transient ischemic attacks, which occur when blood flow to the brain is only briefly interrupted. And a lot of times patients that experience these don't even realize that they've experienced them themselves. They're really quick, and they oftentimes have little to no lasting damage, but the patient might experience a sudden weakness in one limb, or a sudden inability to smile with one side of their face, or some other sign. And the other kind is hemorrhagic, which is when a blood vessel actually breaks inside the brain and bleeds out, which can cause swelling and a lot of other problems in the brain. The only way that that can be treated is by surgical intervention. Now, why should we care about strokes? Strokes kill at least 130 Americans each year, which is 1 in 20 deaths. More than 795,000 Americans experience a stroke each year, not necessarily dying from that stroke. 610 of those strokes are first-time strokes. 185,000 are repeat strokes. And 87% are ischemic strokes, which are the blood clot kind of strokes, and also the most common, obviously. And strokes can result in death or disability, and it is very common, as you can see, so it's a problem that needs to be addressed, according to the U.S. Center for Disease Control. Now, why should we care about stroke education specifically within the means of identification? 93% of victims that experienced symptoms, but only 38% were even aware that these symptoms indicated a stroke. And it's really sad to think of these people that were experiencing a major medical condition and didn't even know what it was, didn't even think to call 911 or seek out treatment. And a lot of times, by the time that they did, it was too late and lasting damage had been done, unless they were, of course, experiencing a TIA. Now, patients who arrive within an emergency room within 3 hours of their first symptoms have a far greater chance of escaping without disability or death than those who delay. Now, there have been a lot of different conflicting studies on this subject, but there are a lot of doctors who have been quoted as saying, because their specific hospital has a stroke protocol in effect, that if someone can get to their ER within 3 hours of experiencing those first symptoms, that they would be able to minimum save their life, if not escape without anything 100% of the time. That's questionable, but you can see the severity of the situation, and that it is really important that we get people who are even beginning to think that they might be experiencing a stroke to an ER. Because worst case scenario, you get there and the healthcare provider will tell you that you are not experiencing a stroke and that you should go home or prescribe you aspirin. Now, 49% of Americans, so half of the country, have at least one of the 3 highest risk factors for stroke, which are high blood pressure, high cholesterol, and smoke. And we can see that it is an effective strategy to educate the public on what stroke symptoms are and what they feel like to be experienced, because with the increase in education in the decade between 1995 and 2005, the stroke rate fell by about 30% because people stopped experiencing the risk factors. They did things about it, they got on medication, or they stopped smoking. And deaths fell by another 14% within that percentage of the population that was still experiencing strokes. Because of that early identification, they could seek out treatment by clotbuster, surgical removal, or flushing. And clotbusters and flushing are only effective within the first 2 hours of stroke experience. Now, if you are a woman, you are officially at risk for stroke higher than a man. Some reasons why this might be are hormonal therapy, such as birth control, or hormone replacement therapy, such as cancer survivors. Pregnancy. Just getting pregnant raises your chance for a stroke. And smoking, of course. Age. By the time you reach 55, each decade after that, your chance for stroke doubles. And along with that, 93% of strokes experienced come from persons aged 55 or above. African Americans are also at higher risk, and they are 1.5 times as likely to have a stroke, just for hereditary reasons. It's not an epigenetic thing, so it's not something that's affected by their environment. They just are at higher risk. Again, if you have had a prior stroke, such as a TIA, so a lot of times you don't even know that you've had a stroke or that you're at that heightened risk, or any other kind of cardiovascular event, such as an arrhythmia or some sort of prolapse or any kind of heart attack, any kind of procedure done on your heart, you are also at a much higher risk. Now, here are some other risk factors for you, which are high blood pressure, cigarette smoking. Cigar smoking is also bad, and believe it or not, e-cigarettes also contribute to this, and that is a more recent study. But some say that they actually heighten your risk more than regular cigarettes because of the different chemicals that's in it. Diabetes, specifically diabetes mellitus. Artery disease, because arteries are what take the oxygen to your brain, and while venous blockages can be really, really harmful as well, arterial diseases cause you to be far more likely to have a clottage in your artery, which prevents you more immediately from experiencing a stroke. Atrial fibrillation, sickle cell anemia, high blood cholesterol, so a high-fat diet can contribute to that. Poor diet, such as, again, high fat and high sodium content, and inactivity. So pretty much everyone is affected by at least one of these risk factors, or they will be at some point in their life. So although preventing a stroke is not always realistic, it is realistic to think that every stroke could at least be identified with proper education, and if people know what to look for. So I'm going to talk to you today about implementing more signage and more public education in what exactly the symptoms of a stroke are. And an easy way to remember the symptoms of a stroke are FAST. So face, again, an uneven face, uneven facial movement, a droopy one side, inability to smile, numbness if one side is blinking but not the other. Arm, so if one arm drifts down or they lose control of it. Numbness, if a lot of times this is noticed when someone's carrying something and then they suddenly lose control of one arm. Another one is speech. So sudden cursing or slurred words or nonsense words or just incoherency in general. A lot of times someone will look at you and say, "You have a sock in your pocket," and they mean to tell you you're late for class or something like that. It has happened. Another thing is to remember that time is of the essence and that calling 911 is always your best bet, unless you could reach the hospital more quickly than an ambulance. Because even if you're not experiencing a stroke, it could be some other kind of health condition, and you need to have that checked out as quickly as possible. And if it is a stroke, your time just started. So the 10 symptoms of stroke that is a more complete list are blurry vision. So one optic nerve isn't working as well as the other, essentially. And so you're going to experience a really weird kind of melting of your vision because one eye is going to still be seeing at your normal level and your other eye isn't. And so your good eye is going to try and compensate for that. And so that's again why in TIAs, a lot of times the person doesn't notice. They just think, oh, my eyes are tired. But you need to pay attention to something as simple as that. Difficulty speaking, confusion again. Arm or leg weakness, which is why a lot of times in the elderly, if they experience a stroke and they're standing, they'll fall. And so a lot of times strokes go misdiagnosed just because they think, oh, the person fell, that's why there's a bruise on their head. Or they just treat the symptoms of falling because their leg lost its strength. Dizziness or loss of balance. Pain on one side. Sometimes it's not numbness, sometimes it could be, a lot of times it is experienced as a heart attack at first because one side in your chest starts really hurting because your heart is working harder to push blood. A headache, obviously. Again, droopy face. Fatigue, all of a sudden you'll just feel really, really tired, but you won't be able to yawn. Hiccups, which is your body's way of trying to inhale extra oxygen. And heart palpitations or breathlessness. Again, this is in younger audiences, younger victims of this will experience this more often because a lot of times those younger people tend to be athletes that experience this stroke. So they're used to breathlessness, they keep pushing through it, and they worsen the stroke. So ultimately, it's up to us to educate people around us. So we can help people around us to learn what a stroke looks like and how to identify it and what to do when we see a stroke. There are almost no drawbacks to learning about a stroke and learning what it looks like. We would only need a small amount of money to create an ad campaign, and that could perhaps be done on a volunteer or intern basis. And we would need to, again, pay teachers to educate people on what exactly a stroke looks like. And this could lead to a much, much brighter future for our families, our parents, our grandparents, and ourselves one day if we can learn to identify strokes quickly. Thank you very much for your time.